سلام و عرض ادب و احترام خدمت همه همکاران نازنینم. امروز میخوام یه کیس جالبی رو با هم دیگه بررسی بکنیم که بیمار خود بنده هستن در شهر زیبای چابهار. از این قسمت به بعد سعی میکنم انگلیسی حرف بزنم تا مخاطبای و دوستان خارجی من بتونن استفاده بکنن. خب با اسلاید اول شروع میکنیم و میریم جلو، کیس رو با هم دیگه میبینیم. I am Dr. Dradib from Iran. Right now I'm studying Master of Orthodontic in Spain. And here we go to see the case and discuss the case. 11 and 8 months years girls, young girls. History of 2-digit sucking till first day of my treatment. And severe anterior and posterior open bite. This is how patients came to my office the first day. We can see this situation. We have open bite and buccal corridor. If you see how is the condition, and next slide we are seeing how open bites look like in this kind of patients. 11.8 months. This is the age. Almost we are in end stage of the growth. So here we see how occlusion look like in the mandible. We are canting, more than 10-degree canting we have seen. And if you see the one side, the right side is below the line, or the true horizontal line. So because she used to put her fingers mostly in the right side, 2 or 3 fingers sometimes, not only thumb sucking. And upper, we can see the upper maxilla, and here we see how much is the open bite in the both side. As we see in the right side is more than the left side, and retain so many milk teeth or deciduous teeth. That's because this is the consequence of the thumb sucker and digit sucker patients. Okay, late exfoliation of deciduous teeth we are seeing here. And this is the lateral self at the point which I started treating and practicing orthodontics in Chabahar. It's the like it's underdeveloped city in the Iran. We didn't have even one lateral cephalometric machine to take these x-rays. So we used to take the general x-ray which was in the hospital, and it was used for others organs and general medicine x-ray machine. So we have taken the x-ray like this. I went there and I taught them how to do it, but we didn't stop. We grow up and we learn more. No, right now fortunately we have one lateral cephalometric, one OPG machine which can take standard lateral cephalometric for us. So here we see how looks like the occlusion plan on the right side and the left side. As you see here, we have more open bite than here. This is the right side and this is the left. And this is the occlusal plan from posterior to the anterior. So this case is not just the anterior open bite. It's complete open bite. Posterior, anterior, and it's difficult to manage them. Very difficult. So what I did, because the patient was almost 12 years of age, I just tried to stop the habit and see what will happen. Does she stop or not? So I just give her the Nance button with creeps, and I explained to her parents that we have to see what will happen. I just take out those milky teeth and those deciduous because it was already late, too late. So I have removed them, I extracted them, and here we see after 2 months, stopping the habit, she stopped the habit. I was lucky because she was grown up already and she was oriented toward the goal, and she wants it. That is very important when you are treating the young patients in orthodontics patients. Their willings is very important. Do they want any change? Do they want to see their face look like better? And if they are willing to get the result and they are coming for the change, so let's do it. They are cooperative. Otherwise you will face hectic problem. So after 2 months treatment, we see the improvement. 2 months, just I stopped the habits. I didn't do anything. This is not an active phase of treatment. This is not the active phase of the treatment. I just stop the habit, try to stop the habit, and let the human body, muscle, forces, and skeletal remodeling happen naturally. I just stabilize and balance the forces which cause the problem. We are just letting the body to heal and to solve the problem by itself. And we are just waiting to see what will happen. So here is the first stage before starting the treatment, and here the second stage. I just deliver the what we call as a habits breaker. So we can see how much is improvement is happening here and here. And in the next slide, as we see how improvement is happening and how patient know is improving after 2 months. If you see there is no enough room for the tongue, that was the mistake I did at the beginning in designing the habit breaker. I could have done better, that I tell you later. So here we see the left side is almost improving and better situation. Look at this and look at this. A lot of improvement, just 2 months. And another side, which is the right side occlusion, still improving, but as we had a patient with a canting in the lower, so this side is getting better, but not as much as the left side. And after phase 1 treatment, which was breaking the habit, I came to know that she is not willing to do it, and we started with second phase of the treatment. The second phase of the treatment, as we see here, lot of improvement. The left side completely closed, and the right side, look at the outcome, how is different. I just started the phase 2 and a lot of improvement, and she is very happy now. Yes, here we see the phase before starting treatment, phase 1 treatment, and phase 2. In the phase 2, a lot of improvement we can see. The left side is almost corrected. And no, as you have seen, we didn't have enough room for the tongue, and the tongue posture was incorrect. She used to keep her tongue because of the habits just down in the mandible, and the maxilla, I came to know in the one point of the treatment, I came to know maxilla is not improving as much as I want, is not developing. So I look at the reason, and I found that his tongue is the main problem. Tongue is not doing their job and tongue is not pressing against the palate. So to resolve this problem, I just changed my mind after I came to know I was sure that she is not willing to do and the habit is broken uh, for guarantee. I changed the appliance. I give her a appliance. It's like quad helix, which will favor the development of the maxilla and dentoalveolar expansion bit. And I put the tongue beads and tongue toy, and I ask her to do 3 times a day the practice, like morning, afternoon, and the night for a first week, each time 10 minutes. After every week's, just 2 minutes increase in the practicing. I just want her to press the tongue against the palate and play with the button which I put there and the beads. This is called tongue bead or myo bead or myofunctional therapy. We are not doing any active treatment except the brackets and wire to do all those alignments. Rest of it, I am just allowing the human body, tongues, mandible, maxilla, muscles, and blah blah to do their jobs and see what will happen. Anytime I can do it, but I believe that not only me, a lot of colleagues and professors and literature, they have said the natural dentoalveolar expansion and development will give better and stable result and make the natural, everything will be natural and beautiful. So this is the appliance I designed with my friends, but I suggest you guys to do the tongue creep for open bite cases like this case at the same time with expansion with higher screw. That will benefit the patient and improve and fasten the treatment, so that you can use, or even you can use ALF. Okay. This is the case. All the teeth are no erupting permanent teeth, and I like this treatment. It's beautiful, and it was one of my first cases with this kind of situation, where in the city which we didn't have any orthodontist till today except me. And let's practice orthodontics, evidence-based orthodontics. Here are some papers: how to treat open bites children with digit sucking, myofunctional therapy. I believe in myofunctional therapy in this kind of children's, and enjoy it. I hope you got some points to treat your patients. And here some are more papers. All are reliable, okay, reliable papers. So here we came to the end. I am Dr. Dradib. I am studying Master of Student Orthodontic in Spain and Holland, okay, and I did my BDS in India and DDS in Iran, right now Europe. And this is my Instagram, Ortho Gamers. I have 2 pages, Ortho Gamers, and my other page is just my name, Dr. Adib Farshodan. So if you want to contact me at any time, you can do it, and you can just direct message me. I'll try to respond to you as soon as possible. So wish you have a good weekend ahead, friends. Enjoy it. Bye bye, and see you later. I am just Ortho Gamer. Bye.